Yeah, we are live now. Hello, everyone. I welcome you to the today's session of thyroid in pregnancy, brought to you by Apollo Cradle. To speak on this topic today, I have Dr. Jayashree Bhasgi. You're welcome, doctor, on the session. She's our in-house consultant. She's a gynecologist by profession, and she has done her MD in gynecology and obstetricians. Ma'am, welcome. We all are here to listen from you about what are the complications with thyroid in pregnancy, what does it cause, what is the treatment, what is the care that we're supposed to take. We are looking forward to hear from you, ma'am. You're welcome, and the session is all yours. Thank you.
Thank you. Thank you. Hello, good evening, everybody. I'm Dr. Jayashree. I'll be talking about thyroid in pregnancy. Um, to start with, I'll just talk about thyroid briefly. Its thyroid gland is a butterfly-shaped endocrine gland situated in the lower part of the front of the neck, just below the thyroid cartilage. You can see it here in this picture, and at the level of C6, C7 cervical vertebrae. It is a very vascular gland and it produces hormones T3 and T4. Together, they are known as thyroid hormones. T3 is triiodothyronine and T4 is tetraiodothyronine. And it also produces another hormone called calcitonin, which is involved in the homeostasis of calcium. I'll be talking mainly about T3 and T4. These two hormones, T3 and T4, are produced by the thyroid gland under the influence of hormones coming from the hypothalamus and pituitary. So, hypothalamus releases a hormone called TRH, which stimulates the pituitary, and pituitary gland in turn releases a hormone called thyroid stimulating hormone. Now, this thyroid stimulating hormone is goes to the thyroid gland and stimulates a sequence of regulated biochemical steps in the basic unit of the thyroid gland called the thyroid follicular cell. And iodine from the diet is also very important for the production of thyroid hormone. So, iodine also enters into the thyroid follicular cell by the help of this thyroid stimulating hormone. So, once the hormones are produced in the thyroid follicular cells, they are released into the bloodstream, 80% of which is T4 and 20% is T3. Most of these thyroid hormones are bound to plasma proteins and called thyroxine binding globulin, transthyretin, and albumins. Of the two, T3 is the most active form of the hormone, and T4 is mainly a pro hormone because in the target cell it is converted to T3. Small fraction of T3 and T4 are present as free hormones and they're known as FT3 and FT4. Now, once the thyroid hormones are released into the blood circulation, they go to the receptors in the target cell. Almost all the cells in the body are having these thyroid hormone receptors. So these hormones, they enter the cell, they enter the nucleus. The receptors are in the nucleus. So they dock on the receptors in the nucleus and they alter gene expression and the mRNA is formed. And because mRNA is formed, the designated function ensues. So what are the functions of thyroid hormone? It basically influences the metabolism of carbohydrates and fats. So it helps in carbohydrate metabolism, helps in the metabolism of carbohydrates by glycolysis, that is breakdown of glucose, and gluconeogenesis, formation of glucose when the glucose levels have gone down with the help of insulin. And it also helps in the metabolism of fats and thereby maintains the cholesterol levels in the blood. And because the thyroid hormone is known to influence metabolism in every cell in the body, it also works on the heart and helps in the contractility of the heart, relaxes the blood vessel, and thereby helps in maintaining the blood pressure. And it helps in protein anabolism, overall growth and development of the body with the help of thyroid hormones, more so in the babies, and also maintains the body temperature by maintaining the basal metabolic rate. So what happens during pregnancy is there is increase, the thyroid hormone increases by 30% in volume during pregnancy to meet the demands of the pregnancy and the growing fetus. So this increase in need of iodine, almost 50% increase in need of iodine is there during pregnancy, because some of the iodine goes to the fetus and the placenta, and some goes for the production of the thyroid hormones in the mother, and the remaining is actually excreted by the maternal kidneys. And the iodine that goes to the fetus is stored in the fetus for future production of thyroid hormones by the baby. So, in the fetus, the thyroid gland is the first endocrine gland to develop. It produces thyroid hormones only after 16 weeks of pregnancy because the pituitary is not developed till that time. But by the 4 weeks of pregnancy, the brain starts developing slowly, and so low levels of thyroid hormone from the mother are always detected in the baby at this point of time to help the brain development. So, thyroid hormone helps the embryo for overall growth, its metabolic regulation, bone maturation, and brain development. Coming to the thyroid dysfunctions, mainly hypothyroidism is seen mainly in 99% of people. Here, the thyroid hormones are low, and the thyroid stimulating hormone, the hormone that is secreted by the pituitary, is high, whereas the thyroid hormone is low. The hypothalamus secretes the TRH, pituitary also secretes TSH. But why is the TSH high and thyroid hormone low? Is it's usually seen in conditions where the thyroid is surgically removed, or it is ablated by radioiodine, or somebody has undergone radiation of the head and neck, or during the formation of thyroid hormones, like I told you, there's so many biochemical steps involved. If there is any disruption of one of these biochemical steps, then there's no production of thyroid hormone. Or if the iodine deficiency is also there, there's no production of thyroid hormone. So what we see is the TSH levels are appropriate or high, and the thyroid hormones, because the thyroid gland is not producing the hormone, the thyroid hormones are low. And other than these causes, obesity and environmental endocrine disruptors are also associated causes. In obesity, we do see a hormone called leptin. The relationship between leptin and thyroid hormone is inverse. Higher the leptin, lower the thyroid hormone levels. And so in obesity, we generally find low thyroid hormone levels. What are endocrine and environmental endocrine disruptors are? People working in petrochemical industries, aluminum foundries, using plasticizers, or staying in contaminated zones. All these people, it is found that autoimmune thyroid disorders are very common in these areas. Now, what are the symptoms of hypothyroidism? Because the thyroid hormone is involved in metabolism and functioning of most of the cells in the body, so fatigue, constipation, cold intolerance because BMR is low, dry skin, weight gain, preorbital swelling, hair loss, hoarseness of voice, memory impairment. It is very important to remember here that not just for the development of the brain, the thyroid hormone is also required for the maintenance of brain function. And delayed tendon reflexes. In women, it is irregular periods and low fertility. So, in pregnancy, hypothyroidism in pregnancy, 3 to 5% of pregnancies, if In the untreated mother, 3 to 5% of pregnancies have hypothyroidism. Mainly, we find that they have first, initially, they have difficulty in conceiving, but once conceived untreated, it leads to miscarriage, or they may have preterm deliveries, they may develop hypertension in pregnancy, anemia in pregnancy, or even diabetes in pregnancy. If the fetus in the mother is not in the fetus if the mother is not treated, the low thyroid hormone, if the thyroid hormones are low before 12 to 13 weeks of pregnancy, there is learning disability and psychomotor delay. And if the thyroid hormones are low in the mid trimester, the baby has low IQ and underdeveloped hippocampus in the fetus. Hippocampus is an area in the brain which is a seat of memory. So that is underdeveloped. It's important to know that the brain is distributed with lot of T3 receptors for better action and better growth of the brain. But in low, when the thyroid hormones are low, the seat of memory, that's the hippocampus, is underdeveloped. Iodine deficiency and thyroid antibodies, if present, they lead to poor cognition in the baby. These thyroid antibodies are the ones which are present in the thyroid cell in a person who has this disease, and it prevents the formation of the uh, thyroid hormones. Attention deficit and hyperactive disorder is also seen in iodine deficiency up to 8 years of life. Some studies claim that. And also, autism spectrum disease is associated with mild to moderate iodine deficiency. Cretinism, a severe form of iodine deficiency disorder, where the child will have swelling of the thyroid gland, which is called goiter, and mental deficiency, hearing and speech defects, stunted growth, and baby also has hypothyroidism. There's an entity called congenital hypothyroidism due to congenital hypothyroidism. I'll be talking about those causes from the mother's side. If the mother's, like I explained in hypothyroidism, if the mother's thyroid gland is surgically removed due to any reason, or if there is a radioiodine ablation of the thyroid gland, or if the person has received radiation in that region, in the neck region, or if there's iodine deficiency, then the baby born to such mother is lethargic, has decreased energy, has hoarse cries, sleeps excessively, hypothermia, baby is cold and constipated. There could be goiter. Goiter is a swelling of the thyroid gland. The skin could be cold, and the jaundice, which has to clear off faster, will clear. There's a delay in clearing of the jaundice in the newborn. Baby will have umbilical hernia. So these conditions have to be picked up very fast and treated early because they are known to cause a neurological. If untreated, it's known to cause neurological problems in the baby. Then, how to diagnose hypothyroidism? As I said, the TSH levels are high in hypothyroidism, and T3, T4 levels are low. So we do the T3, T4, TSH levels, and sometimes we do the antibody test, this anti-thyroperoxidase antibodies. The values for TSH should be 2.5 and less in the first trimester and 3 in the second and third trimester. So if the mother is found to be hypothyroid, it's better to give the thyroid supplements. Dietary iodine is very important for women, especially who are living in iodine deficient areas, and women whose iodine supplementation is not done with iodized salt. The requirement of dietary iodine is 150 micrograms per day, and in pregnancy it is 220, and in the lactation period it's 290. It's high in lactation period because the breast milk also secretes iodine, which goes to the baby. Now, seafood, dairy, and poultry are rich sources of iodine. Seafood, mostly cod and shrimps. Dairy, it's milk, 1 cup of milk giving 88 micrograms, and 1 cup of yogurt giving 75 micrograms of iodine. And eggs, one big egg giving up to 25 micrograms of iodine daily. So, Government of India came out with this project called Iodine Dot, where the mother is given a bindi which is loaded with iodine. And this is given to women who are staying in iodine deficient areas and where even iodized salt is also not used. So it contains 150 micrograms. It releases 150 micrograms of iodine per day. Iodized salt gives 75 micrograms of iodine in 1/4 teaspoon of salt. And to prevent the thyroid, cruciferous vegetables are known as goitrogens because they prevent the hormone production because they contain some enzymes which prevent the hormone production. Soya is also known as a goitrogen. I've added glutens here because many of the autoimmune conditions, like especially the celiac disease, is also associated with autoimmune thyroid. So gluten is a protein which is found in wheat. So gluten's also to be avoided, especially in women who have autoimmune thyroid problems. So coming to hyperthyroidism, where there is excess production of thyroid hormone, it's also called thyrotoxicosis, and it's mainly graves because it's an mainly autoimmune hyperthyroidism is seen. The incidence is very less common, and in women the fertility is low. What happens here is the hypothalamus secretes TRH, pituitary secretes TSH, but there's a TSH receptor antibody which continuously stimulates the thyroid gland to produce this hormone. So there is increased production of T3 and T4, and the TSH, because there is increased production, there's a negative feedback on the hypothalamus to stop producing the TSH, and so the TSH levels go down. There's an entity called gestational thyrotoxicosis, which is physiological. It is seen in the first trimester. The pregnancy hormone, human chorionic gonadotropin, it has a structural similarity to TSH, and that's why it stimulates the TSH receptors in the first trimester, and there's increased production of thyroid hormones. But the notable thing here is that the thyroid receptor antibodies are absent here, and so there's no adverse effect on the fetus. And this condition wanes off after the first trimester. So if it is untreated in pregnancy, it leads to increased risk of heart failure in the mother, miscarriages, then there's stillbirth, hypertension, preterm deliveries, intrauterine growth restriction, and thyroid storm. So if a mother is untreated, what happens to the fetus is there's growth restriction, as I told, and there's advanced skeletal maturity and craniosynostosis. Craniosynostosis is the suture lines in the skull of the fetus that close prematurely. Neurocognitive development, the volume of the gray matter is less, and there's low IQ. Cardiac insufficiency in the fetus because of increased heart rate. There's a swelling of the fetal thyroid, and higher, if the thyroid receptor antibodies are higher, greater is the risk for the fetus. So in newborn, if the Graves syndrome is seen, it presents with swelling in the neck. The eyes are protruding, the baby is irritable. There is a possibility of heart failure and psychological disability. Most of the organs in the fetus are enlarged. So again, the diagnosis of hyperthyroidism is because the thyroid hormones T3 and T4 are very high, there are subnormal levels of TSH hormone, elevated thyroid hormone. If there is it's an autoimmune, then we find thyroid receptor antibodies at the beginning of pregnancy. And in ultrasound, we can by chance get to see a swelling of the thyroid in the fetus. We also see early bone maturity in the fetus. In some countries, they do the fetal blood sampling to see what type of thyroid problem the baby is having, especially when they see a goiter. The safest treatment would be the safest medication in pregnancy, antithyroid medication, and this improves the fetal and neonatal prognosis. Coming to postpartum thyroiditis, postpartum is following delivery. There is inflammation of the thyroid gland, which occurring within 1 year, especially in women who have had normal thyroid function test earlier. So there's a transient hyperthyroidism, inflammation of the thyroid, where it releases more of thyroid hormones, T3 and T4. Then Then slowly over a period of time, we find these women go into transient hypothyroidism where the thyroid hormones are low, and after a year time they return to normal. 20% of these women end up permanently hypothyroid. They need to be put on medications permanently. So I'll be ending my talk here. I would love to answer the questions.
Ma'am, there is a question on your screen which you can answer.
Yeah, I'll see that. Okay, how are thyroid conditions treated during pregnancy and while breastfeeding? Yes, it definitely depends on the type of thyroid problem the person is having, and there are safer medications that can be given during pregnancy and also breastfeeding. Yes, definitely there is treatment. Aarti is asking me, is there a treatment for hypothyroidism during pregnancy to avoid any complications of the baby? Yes, detected early. If the hypothyroidism is detected early, definitely there is a treatment to avoid complications. Okay, what are the lifestyle changes needs to be done to keep thyroid condition in control? Okay, lifestyle changes is like, of course, you need to have the iodine, proper iodine in your diet, and also maintain your weight. Like I told, if somebody is overweight, there is always a chance of the hormone leptin being high, and then hormone and thyroid have a inverse relationship. So the thyroid hormones go down, and it can cause problem. What food should we avoid? Okay. Cruciferous vegetables like cauliflower, broccoli, kohlrabi, turnips, and soya, all these to be avoided, especially if you're staying in an iodine deficient area. And if at all it has to be used, it has to be washed properly and used, and boiled as well, boiled and used. But the flip side to it is you lose a lot of vitamins. Better to use it sparingly. Okay. Um, so hypothyroidism is a treatable condition in pregnancy. It's most commonly found thyroid disorder dysfunction in pregnancy, and earlier it is detected, earlier the mother is treated, it prevents complications in early pregnancy and late pregnancy as well, and also is better for the fetus, because the whole development of the fetus, whether it's neurological or development, skeleton, any organ in the body requires thyroid. So it's good for the baby, and if it is treated early. um, so I think there are no more questions, then I'll end this chat.
Yeah, ma'am, we have no more questions from the patients. So,
Yeah.
if you could, conclude with any concluding message that you have, that
Mm,
or
yes, like I said, it's better to keep your, especially after the age of 35. For, I mean, I'm talking generally for women, it's better to keep checking their thyroid levels. And more so if they have a family history of autoimmune thyroid disorders. It would give them, a chance to lead a healthy life tested early, because once tested late, it would have created a lot of problems in their quality of life.
thank you, ma'am. It was quite insightful. Thank you for your time and
Thank
wonderful,
you.
wonderful information shared with us. Thank you.
Yes,
Thank you, Broad.
yeah. Yes, it was wonderful talking to the Facebook proud I can
session.
say whatever session. Yeah. Okay.
Thank you, ma'am. Thank you.
Thank you.